What's up everyone? Today we're going to talk about posture and low back pain and why they actually don't really go together. So when we think about posture, a lot of times we assume that sitting in the wrong position is what makes our low backs hurt. And what we know is that it actually isn't a single position that maybe is making your back hurt, but there's multiple factors that make your back hurt. Now, I like to think of it as simple as this. There's no such thing as perfect posture. You can sit up nice and tall and have back pain. You can slouch and have back pain, and vice versa. You can slouch and have no back pain, and you can sit up nice and tall and be pain-free. Now, the things I think about when I talk to my patients about back pain and sitting and posture are fairly simple. One, how often and how long are you asking your body to sit in this position? And maybe if you can give yourself a break by mixing up your body position, you'll be able to feel a little bit better, and maybe it won't be as sensitive as your back. So my cheesy saying that I always say is, what's the best posture? The next posture, right? So when we think about, again, back pain, sitting, slouching, you can sit like this. This doesn't hurt you. The weight of your head isn't hurting your neck, your low back. We were born like this, right? That's how we came out of the womb. This is in a safety position. Now this, for long periods of time, 8-10 hours a day without moving, well, that can hurt you, but it's not the posture that's hurting you. It's simply that the tissues that you're asking to respond to that type of position aren't built up enough, aren't robust enough to handle the endurance that you're asking for. It'd be like going or running a marathon and wondering why your legs hurt the next day. They can do it, it's just they're not exactly ready yet. You got to work your way into it. That's why here at SouthWest Chiropractic, we always talk about strengthening your back and finding ways and movements that feel good for you, because again, we don't mind sitting. Sitting is a natural thing. We have to be able to do this and for multiple circumstances, but the ability to withstand this posture is step one, and then being able to, well, let's just break it up. Let's just change how I sit. Let's sit up tall for a little bit. Let's stick our legs out in front of us and cross our legs, or let's maybe just kneel for a little bit, right? There's many things you can do to change how you're feeling and change the way that your body is the demands on your body. So when we think about posture, again, don't worry about it. It's less about your posture and finding the perfect thing and, I need all these ergonomics, to be perfect. And it's more about movement and resiliency in the tissues that you're asking to meet that demand. Lumbar rolls or supports. So when we talk about supports around your back, sometimes you may have sensitivity with leaning forward or slouching. Okay, so let's say we're there, right? We've asked a demand of our back, the tissues around it, and our body can't meet it. So now we hurt when we're in this slouch position, but when we sit up, we feel better. That's not always the case. Sometimes it's vice versa. But let's say we sit up, feel better. Well, then we can have what's called a lumbar roll that can be supported in our low back that'll help assist us. Now, this is kind of like a brace for all intents and purposes. It is not necessarily something that's going to resolve the issue, and it might help short term, but long term, the key to it all is still building capacity in your back and in your glutes and in your upper mid back so that you can withstand sitting for long periods of time without having any problems. You're not damaging anything by sitting and slouching. You're not damaging your neck by looking down or jutting your head out. None of that has been shown to be associated with pain. So when you have back pain and you can't find a way to strengthen it, to use movement to get yourself out of it, a temporary fix is sticking a pillow or a rolled up towel or something like that in the low part of your back, right in the lumbar spine, allowing you to kind of prop yourself up and get out of that flexed position. Short term, fix, I guess, for allowing you to feel better, to increase your movement, to then get yourself out of pain. So that's a simple version of why when we don't really talk about posture here at SouthWest Chiropractic, because we find that it's not really effective. I don't want to scare you into thinking that you're sitting wrong. That's not a good thing to tell your patient. And we want to create an energetic, robust environment where you feel confident doing anything you need to do. And even if that is sitting for 8 hours a day, your body is more resilient than you think, and you'll be able to sit and have no problems because this position doesn't hurt you.